Okay, let's get right into it. Today, we're doing more than just talking about a medical condition. We're actually going to crack open a real clinical protocol to see step by step how doctors fight to save one of the body's most critical organs. Think of it like a high-stakes detective story, a physiological rescue mission where the clock is ticking in a matter of hours.
You know, when you think about a medical emergency, your mind probably goes to all the drama, right? Flashing lights, blaring sirens, a whirlwind of action. It's loud, it's obvious, it screams for your attention.
But some of the most dangerous crises happen in total silence. They unfold deep inside the body, with almost zero outward signs of the chaos that's brewing within. A silent emergency that can be just as deadly.
And that brings us to the big question here. Your kidneys, they're your body's master filter, working nonstop, 24/7 to clean every single drop of your blood. So what in the world happens when they suddenly, without warning, just shut down?
Well, this crisis has a name, acute kidney injury, or just AKI. And the very first step in this whole rescue mission is to understand what we are truly up against.
So here's the absolute key. AKI is a sudden, rapid breakdown of the kidney's most important jobs. You know, filtering out waste, balancing fluids, managing all those crucial electrolytes. We're not talking about a slow decline over many years like you see with chronic kidney disease. No, this is like falling off a cliff. It's a sudden shutdown that happens in just hours or days.
All right, so let's imagine we're stepping into the emergency room. A patient comes in with AKI. The clock is ticking like crazy, and in this first critical hour, the entire mission is about one thing: diffusing time bombs.
And this is what's so fascinating to me. You'd think the first move would be to figure out why the kidneys failed, wouldn't you? But nope. Before any of that detective work can happen, the team has to deal with the immediate, life-threatening fallout. It's basically triage on a physiological level.
And the biggest, tickingest time bomb of them all is something called hyperkalemia. See, when the kidneys shut down, they can't get rid of potassium, so this mineral builds up and up and up to toxic levels. And the really scary part? It directly messes with the heart's electrical wiring, putting the patient at immediate risk of a fatal cardiac arrest.
So, how do they stop it? With this brilliant three-step counterattack. First, you stabilize. You give IV calcium, which basically puts up a protective shield around the heart muscle. Then, you shift. You use insulin and dextrose to literally force that dangerous potassium out of the bloodstream and into the body's cells, hiding it from the heart for a while. And finally, you remove. You use meds or get ready for dialysis to get all that excess potassium out of the body for good. Okay, the bomb is diffused. The patient is stable for now. So, the next phase begins. It's time to figure out who the culprit is. And in the world of AKI, there are three main suspects.
This is where the whole mission pivots. The team has to switch from being firefighters to being detectives. What went wrong? What's the root cause of this shutdown? It's time to identify the villain.
And this lays out the whole investigation for us. Think of it like a detective's clue board. You've got your three main suspects. First up, prerenal. This villain's crime is happening before the kidney. There's just not enough blood getting to it, maybe because of dehydration. The big clue? The patient's history. Then there's intrinsic, where the kidney is the crime scene. It's been directly damaged, and it leaves behind these telling clues, like muddy brown casts in the urine. And finally, postrenal, which is a problem after the kidney, like a simple roadblock that an ultrasound can spot in an instant.
Now, once that villain is unmasked, the entire treatment strategy shifts. The rescue mission becomes laser-focused, tailored specifically to whatever caused the injury in the first place.
And this, right here, illustrates just how high the stakes really are. Let's talk about fluids. If the cause is prerenal, meaning the pump is basically dry, giving a controlled amount of saline can be a complete cure. It gets the blood flow back, and the kidneys can spring right back to life. But if the cause is intrinsic, or the filter itself is broken, that exact same bag of saline can be deadly. The damaged kidneys can't process the liquid, so it backs up right into the lungs. Just think about that. The very same action can be a cure or a killer. That is a real clinical dilemma.
So for that intrinsic AKI, the goal is to remove whatever is causing the insult. You have to stop anything that might be poisoning the kidneys. And you'd be surprised at what's on the list. I mean, common painkillers like ibuprofen, certain strong antibiotics, even some herbal remedies can be toxic to the kidney's super delicate filters. The mission is just to clear the path and give the kidneys a fighting chance to heal.
And what if the villain is postrenal? Well, the solution is beautifully straightforward. You find the physical blockage and you remove it.
A lot of the time, just inserting a catheter is enough to relieve all that pressure and let the kidneys get back to work, almost instantly.
Now, no matter what the cause was, while those kidneys are in recovery mode, supportive care is absolutely everything. This means meticulously tracking every single drop of fluid that goes in and comes out. It means daily weight checks to watch for fluid building up and carefully tweaking the doses of any drug that's normally cleared by the kidneys. It's all about creating this perfect protected bubble for healing to happen. But what happens when, despite all these incredible efforts, the kidneys just stay offline? Well, that's when the team has to call in the ultimate backup plan.
This is that really critical moment. The treatments have been tried, the support is in place, but the kidneys just aren't waking up. The body is filling up with toxins and fluid. How does a doctor know when it's finally time to escalate to that final line of defense?
The protocol gives clear, non-negotiable red lines. Is the potassium still dangerously high after everything you've tried? Is the blood becoming way too acidic? Is fluid backing up into the lungs? Are the waste products building up so high that the patient is getting confused? Any one of these is the signal. It's time to call for renal replacement therapy, also known as dialysis.
Dialysis is, quite simply, an artificial kidney. It's an external machine that takes over all the critical jobs the failed kidneys just can't do anymore. It cleans the blood, pulls off the extra fluid, and fixes the electrolyte problems. Now, it doesn't fix the kidneys, but what it does do is buy the one thing the patient needs more than anything else: time. Time for their own kidneys to heal.
And this quote from the source material just ties it all together so perfectly. Every single step we've just walked through, from diffusing the hyperkalemia to identifying the villain to calling in dialysis, it's not just a list of random things to do. It is a precise, logical plan, a true physiological rescue mission.
And it's so important to remember the context of all this. This protocol was developed for places like Nigeria, where a dialysis machine might not be right down the hall. And that's exactly why it puts such a huge emphasis on high-impact, easy-to-get tools, like an ultrasound, to quickly rule out a blockage, and why the hyperkalemia management is so aggressive right from the start. It's a plan built for the real world.
So we end with this thought. A protocol like this is so much more than just a set of instructions. It's this perfect marriage of deep scientific knowledge and really pragmatic real-world problem solving. It just goes to show you that saving a life is about understanding the body's machinery and knowing exactly which tool to use at exactly the right time.